So thank you for joining us for this workshop today, which is focused on helping you create a care map, whether it's for yourself or you maybe are thinking about helping others create their care maps. So thank you for joining us. If anybody needs to use closed caption, it is already enabled. So you can click on the live transaction or transcript in the Zoom control bar at the bottom. If I've just confused you, please look in the chat. I believe the instructions have put in the chat as well, how to access that closed caption if you need it. Okay, thank you for joining us for the Atlas CareMap workshop today. And we are co-hosting it with the Dorothy Ley Hospice, which is great for us to be able to do this virtually. We were hoping to get to do this in person, but you know, it didn't quite work out. So here we are today. So first, I think the both of us would like to take a minute to just sort of acknowledge the land that we're on. So I'm going to go first, and then my co-presenter Dana will be doing hers after. So first, I'd like to say I wanted to take a moment before we get started to acknowledge the land I'm presenting on today, which is the city of Ottawa. It's the traditional unceded territory of the Algonquin Anishwabec people. I would also like to acknowledge the land I was born on, which is in New Brunswick, which is the unceded territory of the Wabanaki people. Dana?
Thank you, Bonnie. My name is Dana Colburn. My ancestors are Polish and Ukrainian. I was born and raised in rural northwestern Ontario in a small town called Dryden, 10,000 people. I'm grateful for the opportunity to work with the Dorothy Ley Hospice as a spiritual care coordinator. And the Dorothy Ley Hospice and communities we serve are located on the traditional lands of several Indigenous nations, the Wendat, the Anishinaabe, Haudenosaunee, Métis, and the Mississauga of the Credit First Nation. The name Etobicoke comes from the Ojibwe word that describes the area between Etobicoke Creek and the Humber River, which is the place where the elders grow. The territory we live and work on every day is governed by Treaty 13, which is the Toronto Purchase Treaty of 1805 between the Crown and the Mississaugas of the New Credit. It is also governed by the Dish with One Spoon Covenant, which is an ongoing peace agreement between many Indigenous nations to share the land, taking no more than is needed, leaving enough for others, and taking care of the land for generations to come. Thank you.
Just quickly, a little bit about the Palliative Care ECHO Project. So this Palliative Care ECHO Project is a 5-year national initiative, and it's about cultivating practices and establishing continuous professional development, basically around palliative care and end of life for patients across Canada. So if you want to learn more, you can check it out at the following address. We'd also like to take a minute to say thank you to Health Canada, because Health Canada has provided the funding for the Palliative Care ECHO Project, as well as the creation of the Atlas CareMap resources, which you're going to get to use a few of them today. So we'd just like to thank them. And we'd also like to acknowledge Atlas of Caregiving out of the US. So the Atlas of CareMap tool that you're interacting with today, and if you attended the webinar in February, you would have seen some more of those resources. This work is all based off the tool and the research that they had completed in 2015. And so they were great to work with us and allow us to take that tool and basically build on it and adjust it for the Canadian context. So we'd just like to say thank you for letting us build off that resource. So just quickly, a little introduction about myself and Dana. So my name is Bonnie Tompkins. I'm the Compassionate Communities National Lead, and I work at Pallium Canada. And then I will be co-presenting with Dana, and she's the Spiritual Care Coordinator at the Dorothy Ley Hospice. In the GTA, is that a correct way to reference where you guys are located?
I think so, yeah. We're in Etobicoke, which is on sort of how to describe it, on the outskirts of Toronto or
Yeah,
a
just
suburb?
sort of west. Yeah.
West, yeah.
Okay, guys, just a few little reminders. So please introduce yourself in the chat, because we know we have a lot of people here from across the country and maybe even internationally. We had a few international people on our workshop Wednesday evening. Your microphones are muted at this time. But if you have any questions and things like that, you can put it in the chat. And then if we have time at the end, we will do questions as well. And we'll probably unmute at the end. You're all welcome to use the chat function to, make comments. We will be asking, for some feedback and reflection and things like that. Also, if you're having any technical difficulties, we will be doing an activity later on. So we'll be breaking out into focus groups and just working in pairs. So as well, it will be important if you're having any technological issues, then please just put it in the chat and we can help out with that. Just so you know, the session is recorded and that recording will be going out to everybody within a week or so. So you'll all have access to that recording, and I believe the slide deck as well. And remember not to disclose any personal health information during this session. Okay, I thought I'd take a few minutes just to introduce PALIUM in case you haven't been with us on one of our webinars before. So PALIUM is a national not-for-profit. We've been around since about 2000. And the focus of PALIUM's work is to build capacity to provide palliative care to every Canadian in Canada. And so with that building capacity mindset, we look at a few different areas. And as you can see here in the image, healthcare organizations. So how can we increase capacity there with healthcare professionals, and then also community, because we've been hearing for many, many, many years that community wants to get involved. So how can they get involved? So those are sort of the three main areas where we are working to build that capacity in hopes that everybody in Canada will have access to some sort of palliative care when they need it. And so, it's about transforming practices and the settings. We are also doing a lot of research, so to drive that change. And then, as mentioned, empowering communities to get involved as well. And so this is an example of that community piece where we're hoping, if you're not a caregiver on here and you're someone who wants to help out, you'll help others draw their care maps. Okay, Dana, over to you.
Thank you. All right. So the Dorothy Ley Hospice is where I currently am working as a spiritual care coordinator. And there's a few representatives from Dorothy Ley here. My manager, Lisa, and the wellness coordinator, I believe, Pranita Murphy's also here, maybe, and Janice, our community outreach people, and anybody else, I'm sorry if I miss you, are all here. And as you know, or may not know, hospice is not just a place, but it's an approach to care that focuses on living. So we were founded over 30 years ago. The Dorothy Ley Hospice offers compassionate care to people living with a life-limiting illness, their family, and their caregivers. We aim to improve quality of life and relieve suffering by providing pain and symptom management, psychological, social, emotional, spiritual, and practical supports. We offer community hospice care in the home, residential care in our 10-bed residential hospice, caregiver supports, wellness supports, and grief and bereavement services. And I can honestly tell you, I'm a bit biased, but I love my job, I love my work, and we have a great team here at Dorothy Ley. All right, learning objectives. Okay, so here is what we're going to learn about today by participating in this workshop. You'll develop a better understanding of what a care map is and the benefits it will have to caregivers and care recipients. We will build our own care map and learn how to share it. So to achieve this, our agenda, the learning objectives, today the workshop will cover the following topics. Part 1 will cover what a care map is and why it's helpful. Part 2 will go into creating a care map. And in part 3, we'll be putting our care map together and to work and share our care map with each other. During this section, we'll be doing an activity that will have us partner up in breakout rooms to talk about our maps. And in part 4, we'll be introducing organizations and resources that support caregivers and care recipients. We also want to take a minute to mention that if you have any caregiving experience, you may find some of this content tough at times. So please take a break, mute us, walk away. Don't forget that this will be recorded, so you'll be getting a copy of the recording after the session. All right. I want to take a quick moment now before we get started to go over some key terms and what they mean for this workshop's purpose. That way, we are all on the same page. A caregiver is a family, friend, or community member providing unpaid care with daily activities to an individual with a medical condition or illness. A care recipient is the individual receiving care. The healthcare professional is a member of the medical profession who is providing care. This includes your doctor, your nurse, physiotherapist, pharmacist, or anyone providing medical care. Your support network is the individuals that support you, whether that is physically or emotionally. We would like to start this workshop by taking a few minutes to get everyone warmed up and get to know each other. We have created a poll to understand why you want to learn how to create an Atlas CareMap. Please select the answer that best applies to you.
So it looks like the bulk of the people on with us today is either someone who wants to support a caregiver in their practice or organizations who may be serving caregivers. I see we do have a couple of caregivers as well. A couple of people who want to support a caregiver personally, which is great. So this is all bringing in the community.
Research shows that in the last 12 months of a patient's life, the medical care provided to a patient adds up to about 20% of the total care. That leaves the other 80% of care to be supported by the caregiver. Now, it makes sense that caregivers have expressed feeling overwhelmed and stretched during this time. The question is, what if other people became involved in supporting the care, like your family, your friends, and community services? By attending this workshop, you are taking action to help change this. It is time to build more community capacity, leaning on each other in trying times, and reaching out to family, friends, and community services. So let's begin learning about what a care map is. One of the challenges of caring for others is coordinating the people and services involved, whether by tasks or by supports. It is hard to keep clear who is doing what and whether, it's hard to keep clear who is doing what and understanding who else is involved and how their actions affect each other. A care map is a simple visual diagram of the people involved in providing care to the caregiver or the care recipient. It includes family, friends, and healthcare professionals who provide assistance and support. However, big or small, having a care map helps coordinate and understand the support network and the various people involved in caring for someone. It helps everyone in the support network have a clear picture of the caregiving experience, better organize the tasks and activities while highlighting additional support areas. In your welcome package, you received a document titled How to Create an Atlas CareMap. We want to point out that there are links to several short videos which you might find helpful in the future. This map is a simplified version of what a care map could include. In the household, there is Shelley and Eric, who support each other as partners. They are both the primary caregivers of Joan, as she cannot do most tasks. Joan has a doctor, Dr. Rupert, who is involved in the care map. You can also see that Claire takes care of Dot, the cat, and supplies emotional support for Joan. As you're looking at this map, think about how big your care map might be. Think about the individuals that help you, even with the small things. And there are no small things. Altogether, the difference these individuals make will have a lasting impact. This support allows the caregiver to spend more quality time with their loved ones and time for self-care. People are often uncomfortable asking for or accepting offers of help from family and friends, despite a clear need for support while giving care. People are willing to provide support often, and they don't know what to offer. Remember, people want to help and feel better when they do. They might need a little direction, though, on how they can help. It is important to note that accepting help or asking for help doesn't mean that you are weak or not in control of your caregiving role or a burden to those around you. Instead, it actually shows that you have great strength and that you know yourself and your limits. We need to, as a community, shift our ideas of what is socially acceptable so that people do not feel uncomfortable when asking for or accepting help from one another. We cannot do it all. The fact that we are here today shows that we are all concerned and we want to improve the experience for yourself or someone close to you. So let's get started. In this next section, you will be making your care map. We recommend making your care map by hand the first time. This approach lets you easily make changes and take notes and about what is working and what isn't. Please open up the care map how-to guide and the care map building questions that were emailed to you as part of your welcome package. If you cannot find them, we have dropped the files into the chat box. Please download and open the file and have them visible to you while creating your map. The documents together provide you with detailed steps on how to create your care map.
So what we're going to do is we're just going to show you a little video around how to create a care map. And that's one of the videos that Dana referenced earlier on, because we recognize everybody learns differently. So just bear with me while I change screens and show you the video.
Drawing your own care map is easy. We're going to show you how to do it using information that you already know. So grab a pencil, paper, and an eraser. Using symbols to represent people, first you'll draw the people and pets that live with you. Then you'll add any other people you care for, add other people who are also caring for the people you care for, add those who care for or support you. You will draw arrows to show who cares for whom, using different types of arrows to show how often that caring happens. Finally, you'll add a couple of lines to indicate who lives close by and who lives really far away. Still need help? Get our how-to document to get written step-by-step instructions and a handy template.
All right.
Back to you, Dana.
Thank you. So to make sure you have both the how to create a care map and care map building questions document open, now let's start getting through the steps listed in the how to create a care map document. Also, use the first section from the care map building questions document titled Creation Questions to help you think about what should be included. Let's start by going through the steps together. Then you'll have time to create your care map. Instructions. Start by drawing yourself in the center of the page and adding the people who live with you and draw a house around them. Add anyone you care for to the map, including any pets, Fido or Steve, or whoever or Luna. Add anyone who also cares for the people you care for. Now add the people that support you, no matter how little or small that may be. Start drawing arrows to show the relationships between the people on your map. Use different types of arrows to show how often that care it takes place. For example, if you are caring caregiving to someone in your home, you might want to have that arrow to be thicker than any other arrow you draw. Feel free to use different colors instead of different lines. Just create a legend so you don't forget what color is for each. And lastly, add to the map all the healthcare professionals who care for you and the care recipient. You can use a triangle to represent them. Okay, so you now have about 10 minutes to start drawing your map by hand and using the two documents that we just mentioned.
Okay, guys, that was about 10 minutes. So I think we'll come back together. Don't worry, you're going to be back on your map in a flash. Okay, Dina, over to you.
So now that you have made your care map, we will go through some questions to help you reflect and to revise. The purpose of this is to see where you might have forgotten people or perhaps some activities. It will also highlight opportunities for additional support from people in services already on your care map or not on it yet. When reflecting on your care map, you'll have the option to add any tasks or activities that, if supported, would be helpful. For example, help with walking the dog, tending to the flower gardens. Find a space on your map and write the word wish list. And then that's the list where you'll be able to capture any of these additional tasks like walking the dog or tending to flowers or any activities from the review questions. When sharing your care map with your family and friends and healthcare professionals, you can show them your wish list. Showing the wish list allows them to offer help with what's on there or provide community services suggestions. Having a list to show removes the tension out of the asking for an offering or help conversation. The person will identify what they can help with or suggest perhaps a service. Please look at the care map building questions documents, second page. I have placed it in the chat box again, which has questions to help you reflect on your map. These additional questions will help you see if you've missed people or services and highlights any supports that may be needed. Remember, if you have new tasks or activities you would like support with, place them on your wish list. Have the question document visible when you're revising your care map. Take a few moments to review the questions, add them to your map if needed. Please take the next 10 minutes to reflect on your map.
Okay, guys, I think we'll wind down this portion, and then we're, as mentioned, going to move into putting our care map to work. And a part of that will be actually getting into the breakout room soon. So let's get started. So now that everybody's created their care map, let's look at how to put that care map to work. So engaging your community is how you can add more supports to your care map. We have included the following guides in your welcome package. So that package you received in your email, you should see these following guides: care map sharing with family and friends, and sharing it with healthcare professionals. So these guides are basically going to give you talking tips or conversation tips, give you little ideas on how to carry the care map with you, how the care map might integrate with other things. So definitely have a peek at those two guides, because we know the conversation piece can be a little nerve-wracking to get started. You can also access copies of the guide on Pallium's website using the link in the care map fact sheet. That's where you can find lots of stuff, including the community workshop toolkit, which is what we're using today. Okay, so we will talk about how and why to share your care map with family and friends, but now let's focus on healthcare professionals. Here's some easy steps for sharing your care map. Step one, be prepared to explain the purpose of a care map, because they may not have come into contact yet, and why you've created one. By attending this workshop, you engage with the knowledge and will be able to better explain the purpose and the benefits of a care map. Step two, prepare a list of questions that you can take with you that you might want to ask that healthcare professional. You could ask for recommendations where they may see resources benefiting your care. So also from that wish list would help with that. Bring your care map with you to all appointments, continuously reviewing that care map, especially if there's any change in health. Adjusting that care map will be helpful. Think of it sort of like a living document. It needs to be adjusted as the journey changes. And then sharing your map with your healthcare professional will allow them to see your support network and your wish list, as I just mentioned. This way they can help connect you with resources or services to address your wish list. By better understanding what is important to you, they can provide you with the appropriate medical care. And so they can almost integrate it into your sort of care plan, right? And so every time you do a follow-up with them, you can reflect on that care map and how things are going. Pallium has developed a healthcare module to increase the awareness of the care map program. So we have another resource to support the healthcare side. And it's focused on how to use the care map in your practice to better support your patients. You can access this module on Pallium's website. So that link we've sort of mentioned in the fact sheet, that'll take you right to where that module is. So broadening your support network. So now that we've talked about sharing your map with healthcare professionals, let's look at how we can broaden your support network by sharing that map. The wish list you placed on your map during the reflection activity was designed to help with this. So you can use that wish list to ask for support or ideas on where to look for supports to address what is on there. And family, friends, healthcare professionals, basically anybody you interact with, I would show them that map, because you never know who's going to be able to support you or might have an idea of a community support. By sharing the wish list, you remove the barrier to talk about, asking for and offering help. We know that that's a big barrier and a challenge in this space. And so that's why we created the wish list piece, because then people just see it, right? And it's much easier for them to sit and go, oh, I can do that for you. No problem. Like, put my name by that. So that's sort of the purpose of the wish list. Okay, so we wanted to talk about some of the barriers that might come up during conversation, because certainly the Dorothy Ley Hospice has been doing some care map sessions already. And so there are some common ones that come up, so we thought we'd address them. So some of those conversation tips that might help with potential barriers, if you're someone, for instance, helping build a care map, or if you are a caregiver and maybe you're sharing your wish list. So the first one will be, when sharing your wish list, explore what it is that you are hoping people around you can help out with. You may get a response along the lines of, sorry, but I can't help with these, which is a bit sort of, might take you off or like catch you on guard. So just simply be honest with them and say, thank you for being honest with me. Now I know, like, just at this time, you can't help out. And I think what's important here is to remember, like, we never know what's going on in other people's lives. So just thank them for being honest. The next potential barrier would be if you were helping create a map with someone. So whether you're a healthcare professional, community organization, or you're just someone who wants to say, help a friend build their care map. And so when you're creating that care map, someone may express that they have no connections to help for their wish list. We know there are Canadians who are isolated. We hear that more and more in the news. And so it can be, and that can be for a variety of reasons. They could be newcomers to the country, their family could be far away, you never know, right? However, helping them think about the places they visit and the people they regularly engage with can highlight potential connections points that they wouldn't have initially thought about, or maybe they wouldn't have seen them as a source of connection, right? So just sort of prompting them to think about, do you attend any groups? Do you go to the library regularly? Do you work? Do you chat with a colleague regularly? That sort of stuff. So sometimes people don't think about those connections or necessarily value them as much as, say, a healthcare professional or something like that. So don't be afraid to sort of prompt them a little bit. In this situation, it becomes even more important as well to explore community supports that can help this caregiver. And we're going to talk about that near the end. And as well, on Pallium's website, all about this resource, there is a document that is solely focused on how to find those community supports. Okay, so it is activity time. So in a few minutes, we are going to break you into breakout rooms in partners of 2. And so the purpose of this is just to get a bit comfortable with talking about your care map, and then the other person to sort of prompt and ask questions. So we did email you a document called the discussion activity, and I think it'll probably get dropped in the chat just in case you don't have it. So the first thing I would have you do when you go into the breakout room is just have a look at it and decide, what role are you going to take? Are you going to talk about your map first, and you're going to be the person sort of listening, maybe asking some questions, and then we'll give you a halfway mark where you're basically going to flip in the activity. So also, it's really important not to have a background on Zoom. So don't have one on, but say if you have like the blurred background, it makes it really hard to share your map, because this is basically how you're going to have to share your map. You're going to have to hold it up and sort of talk about it to the other person in your breakout room. So if you need any help with figuring out how to turn off your background, you know, check the chat, because we might be able to help you out with that. And you're going to have about 15 minutes to do this. If something happens in the breakout room, say for instance, one person ends up like getting kicked out or something like that, and you're on your own, just put it in the chat. And we, like on Wednesday night when we did this workshop, we all jumped in and sort of helped out. So just let us know if there's any issues via the chat. Okay. So just, you know, be respectful, let everybody present their map. It's probably, you know, going to be a bit of a process because it's the first time they will have talked about their map, but let's give it a try, because it'll only increase our confidence in future to be able to talk and share our map. Okay, so I think the Pallium team is going to be great and break us into our teams. Okay, guys, I'm just going to readjust my screen. Can you guys still see the slide deck, or do you need me to reshare?
We need you to reshare.
Thank you. Exactly what I needed to hear. Awesome. All right, we're back. Well, I hope everybody found that interesting. So I actually got to jump into one of the breakout rooms, which was really great because this person is in that healthcare professional role. And so we had a really great discussion about the use of the care maps. So as part of a little recap, we would love to hear from you guys what you sort of thought about creating your care map, the reflection piece, the wish list piece, and I think we have a bit of time to do that. So if you can either mention it in the chat, or if you want to unmute yourself and just share a bit of feedback with us. We'd love to hear what you thought. And if we don't hear from anybody, we will move on.
Hi, this is Diane.
Hi, Diane.
Mary Lou and I discussed the wish list, and one of the questions that came up to us is, who are we designing the wish list for? Is it for the recipient of care or for the caregivers, or both?
Sure. Both, right? So the way I think about it is, you know, something on that care list, wish list you might put is, say your care recipient loved going to the library and getting a new book every week, right? And so now that's a task maybe that's on you because they're unable and mobile to go get that book. So all of a sudden, you know, you could put on the wish list, pick up books from the library, right? And so while it actually directly impacts the care recipient, but it also helps you out because you wouldn't have to go and do that. So thanks for the question. Anybody else? Anybody have feedback on creating their map?
If I may, Mary Lou and I also came up with a thought that sometimes being a caregiver involves a great commitment of time if you're caregiving from a distance. So parents in another province. And that for her, it meant time away from work. it also means resources, right? Time to travel, fuel to travel, and who's looking after things here while you're away.
Yeah.
Thank
Yeah,
you.
and that's a great point. My parents were living in New Brunswick, and so my sister and I often in Ottawa were trying to support them. And we're going to talk about some of those resources that will help you support from far away. I think the other interesting piece around supporting from a distance is you kind of have to get creative sometimes, right? And so sometimes it might be, paying for food to be delivered or paying for groceries to be delivered, that sort of thing. So, I mean, I think a lot of times people feel like they can't contribute, but you can. And also you can provide a lot of emotional support as well, which the person I was in their breakout room, that was sort of one of the things that they really talked about.
One of the wonderful things that's been emerging for a while now is companions for hire, right? That is a great tool when you live far away.
Mm-hmm. Yeah, so just sort of looking at the chat here, because I see a few people have put in, quite a few people like the wish list idea, which we're really happy about because that was a piece we added, because really Pallium really recognizes that's a big barrier, the offering and accepting help. And so this was something that we felt could maybe reduce that barrier a little bit. So that was great. And really you can put a variety of things on there. Like I just sort of mentioned, it might be picking books up from the library. It might be sitting with someone so the caregiver can get their yoga class in, which is good self-care for them. So it can really be such a variety of things. Yeah, and so someone was saying here about it was an eye-opener, and also because it focused on the caregiver. And I think quite often things are focused on the care recipient, right? Especially from the healthcare lens. And so we heard that same thing in our Wednesday night session that we did with Compassionate Communities Kingston, was just sort of like how different it was to focus on that caregiver for a change, right? And actually how sort of nice it was. Yvonne, I see you have your hand up.
You knew I would, Bonnie. I loved our conversation. Angela and I had a great chat. And one of the things that is so important is to, like you said, Bonnie, be creative. I always read high school volunteers or high school students all have to have 40 hours of volunteering to graduate. Wouldn't it be wonderful for them to come and play cards with, somebody? And so there's that whole creativity. And I also realize many people want to help, right? So we really need to get good at asking and designing these maps proactively as well, so that we're not waiting until we're in crisis, right? And so being creative and involving the whole community. So it's a great idea, even better if before we need it.
Yes, absolutely. 100%. And I'll go back to my breakout room because I did get to be in one. The person in the breakout room had created their map, even though they weren't necessarily in that per se caregiving scenario, or they needed caregiving help. But, the great piece was, as Yvonne just mentioned, she had started to put in all these connections, right? And so as maybe there comes a day where that person does need help and support, very quickly they can pull out that map and see all these friends and connections that then they can maybe start to pull on, right? So absolutely start sooner than later. Okay, guys, we're going to move on. Feel free to keep putting things in the chat, but we want to make sure we get some time in to talk about, where you can find supports and things like that. So thank you, everybody. So before we move on to the last part of the workshop, I wanted to revisit the pie chart. So this pie chart at Pallium has become, you may have seen it if you've ever been to any one of our sessions, especially on the community side, right? Because the whole point of the pie chart is to really help people see, 80% is a lot, right? And if I could just take on some of those tasks from their wish list, like walking the dog every day or something like that, like it just will make a huge impact. And so, you know, that's why we continually sort of come back to that pie chart, because we want to reduce that white space. And we really, really feel that that's absolutely something that a community can help with. And this Atlas CareMap tool will help facilitate that. Okay, so now let's get into where you can find additional supports. So again, we have a whole document on PIME's website, so I really would encourage you to go there. There are 2 toolkits on that site. So the first one, which is focused on creating the map, you'll find that document in there. But certainly hospices, right? So have a look around in your community if you're not already working at a hospice or volunteering, because if they maybe don't have a program or a day program or something that can help you, they're also probably going to be able to help point you in the right direction to make connections in the community. So really look around. 211.ca is another great example. So it's a community database across the country. What I love about it, it's in 150 different languages. You can call in or you can look them up online and then sift through. And so often, like if my mom and dad needed help in New Brunswick, I'd be on 211 New Brunswick and I would be finding help for them. So 211 is a really great resource. You can also look for your own local community database, but I will say 211 should actually have your local database. They feed into each other. But if not, have a look around for that database. I used to work in Burlington, the Halton area, and so it was actually situated with the library system, which I thought was really great. Regional caregiving organization or associations, there are quite a few. They're constantly evolving because caregiving has really become a topic of focus, which is wonderful. And I'll highlight a few of those associations in the next couple of slides. The library resources. I mean, really, libraries are a hub. They're a neutral space. So, you know, if I was looking for anything, honestly, I would probably go and ask a librarian and they would pretty confidently be able to help me. Mental health resources as well, right? Because caregiving can be taxing. Another couple that we wanted to mention was the Canadian Virtual Hospice. So it supports Canada. There are a lot of resources on there, so you may want to check out CVH for short. There's Speak Up, the Speak Up campaign that just sort of helps with advanced care planning and conversations, and then you'll have it specifically by province. So you could check out speakup.ca and then look for your local province. And often they have communication tips and things like that as well, if you're doing maybe some planning for end of life. All right. So we thought it was, you know, important to sort of highlight that 1 in 5 caregivers have expressed in Canadian research that they have felt physically and mentally that their health has suffered, right? And, you know, really just hammering home that 80% again, right? Like, how can we just chip away at that? Even if, you know, all of us, 10 of us take 0.5%, right? Like that's a reduction for them. And it will just help them, right? So as Dana mentioned earlier, you know, nothing is too small, because when we sort of put all those too smalls together, it makes a good impact, right? And, you know, with the fact that we know about 25% of the Canadian population is providing some sort of caregiving, you know, that's a lot, right? So we all have a role to play in helping out. So here are the Canadian or the caregiving organizations that we're aware of at the moment. But again, this is evolving regularly. So we have quite a few across the country. Then we also have Cares Canada, who's sort of at that national level. So if you're not quite sure, Google look around 211.ca can probably help you. And yeah, and there's a lot of really great resources with all of them, right? So I would sometimes even explore the other associations, even if they're outside your area, because they have a lot of really great resources and you might find something that's helpful. we wanted to just highlight two sort of research programs that support this work. So the first is the Frome model. And so that is in Frome, UK. And what it was really focused on is making that active connection between the healthcare professional and the community. And so basically what was happening is healthcare professionals got trained on what community resources existed in the community and some of those talking points around how to ask patients about their social connections. Who do you interact with regularly? Do you attend any groups? Things like that. And so it was partly about strengthening their social connection. And so they may be fairly healthy and they may not need additional support at that time, but being proactive, as Yvonne said, right? So strengthening that social connection beforehand. And then what happened in this research project is, so you had physicians, whenever they are interacting with their patients who are maybe senior, they would be asking these questions and then pointing them to community supports in the community. But then at the same time, the community was sort of getting tipped off about, oh, this person needs to connect in with these organizations. So really started to create a communication between the two. And what they saw was a massive reduction in ER visits. It was phenomenal. I think they were at 28% and they got themselves down to 10 or 12. Like, it was a massive reduction in ER visits because people felt more supported. And so instead of running to the ER all the time, like, they would know where to look in the community, or they could ask for help, or they knew a phone number to call, right? So it really, it had a very positive impact. If you want to learn more about the Frome model, just Google it. You'll find lots of information on it. And in fact, there are a few compassionate communities in Canada who are working to replicate the Frome model here. The other one is the HELP project. So that comes out of the US, and the HELP project is really focused on the barriers, right? The asking and offering help. Like, that's the big part of the HELP project. And so actually Ottawa is running the HELP project right now. So Compassionate Ottawa is a part of that initiative. And so again, if you want to learn more about the HELP project, just, Google HELP Ottawa, and I'm sure it'll pop up. It's a research project as well. Okay, we're coming near the end, and we will make sure there's some time for questions, because I think we're getting near the end of our time. So if you can stay on, great. If you can't, the recording will be sent around. So we just quickly wanted to talk about some of the ideas around how you can engage, because hopefully we've fired you all up and you want to see what you can do with this care map. So if you're a healthcare professional, what we wanted to highlight was sharing that care map, like with any patients who might be in that caregiving role. So you could give them the fact sheet, for instance, right? Encouraging them to draw their map. So maybe you help them draw their map, or you host a care map workshop for your practice, right? For your patients in your practice. And then also integrating that map into the appointments, right? So every time you meet with that caregiver, maybe ask them about the map and talk about the map. See if there's any changes, anything new that might need to be addressed. So those are some of the ways as a healthcare professional you can get involved. And again, there is the healthcare module that's on the website on that fact sheet that we gave you. How to get involved if you're in an organization. And I'm pretty confident most of us are in here. So you can share the fact sheet within your organization. So basically with your employees, because you never know who's caregiving. You could share it with your customers, right? Like, you'd be surprised. Even, I'm thinking like a librarian could share it with people who come in or maybe asking about caregiving support or caregiving books, right? Like, really, this has legs, right? So just share it around is the idea here. Share it with anybody you volunteer with. If your organization has partners that may be some of their target audience could be caregivers. So increase the awareness with your partners as well. And host a workshop, right? Host one in the community. You don't have to do it by yourself. Pair up and host those workshops. And then if you're an individual, right? And I'll say, you know, an individual who's passionate can really make some great waves, which I love. So please don't sell yourself short if you're just, you know, you're interested in this tool on your own, because you can either help caregivers draw their care map, you can talk about it in the places you work, you volunteer, what have you, right? So think about those platforms. You could post on social media, you could share with groups that you volunteer with, you could share at your faith communities if you're a part of a faith community, like really share it everywhere. And then also you can host a workshop. And again, partner up, right? Like partner up with a cafe, who knows, right? That really the options I think are quite limitless. So feel free to get involved. So just a quick overview of the workshop today. So creating and using a care map. It's really about increasing the understanding of that caregiving role, increasing the caregiver's feeling of supported, because once they look at their map and they see all these lines and connections, all of a sudden it probably validates what they don't necessarily think about on the day-to-day, is that, oh wow, like I actually have quite a few people who I could lean on if I needed to. Helps with those conversations, right? So that wish list, we're hoping is going to help that barrier for offering and accepting help. And in turn, by sharing that map with anybody who sort of says, hey, how are you doing? Or can I help, right? Share that map and broaden that support network. Ultimately, it's going to improve the caregiver's quality of life, right? While they're on this journey, and also the quality of life of that care recipient. So here's a couple of more Pallium resources that you might be interested in. So there, as I mentioned, there are a couple toolkits specifically around this tool. So there's the Atlas CareMap toolkit, which again is focused on just building that map, right? So you as a caregiver can use it to build your map, or if you're helping people build their maps, you would download that and use those materials. There is also a community workshop toolkit, which is what we've used here today. And it includes the slide deck, right? So it would help you present and help people draw their care maps in the community. If you're interested in the compassionate communities movement and learning more about the, you know, how the community can help people who are caregiving, grieving, dying, you might want to check out that as well. All that information is here on Pallium's Compassionate Communities page. And just as a little reminder, we will be sending a survey out to everybody. And so please fill that survey in. That helps us understand if this workshop was helpful. So I think now I'm just going to open it up to questions, because we're at the end. So if anybody wants to provide any feedback, do they have any other questions? So Mary Lou, I see your hands up.
Yes. So first of all, Bonnie, thank you so much. I'm always so enthused when I hear about compassionate communities. So thanks to you, thanks to Dana, thanks to Dorothy Ley Hospice. You guys rock, honestly, for getting on to this project. And that is my question. Can you share, whoever from Dorothy Ley, maybe Dana, how far have you gotten in the use of the Atlas CareMaps?
I could perhaps take that one, Dana. Hi, Mary Lou.
Hi, Lisa.
Hi. So this is new for us. So we're just starting exploring with care maps. We've used them a few times here to get better understand and learn the tool. Our intention going forward is that what we hope to be able to provide is either workshops or small group sessions with folks in the community as who are caregivers. They might be people who we are currently supporting at the hospice, or they might be other people in the community. And also working with other community agencies who work with frail complex seniors who might benefit from this tool as well. So that's our primary sort of focus at the moment, but it is you know, evolving. So we'll learn as we go as well.
Great work. Mm.
I just want to ask quickly, is there anybody on here from Compassionate Kingston by chance? Sorry, I can't see the full list. If there is anyone, you can unmute yourself and sort of talk about how you're using it. That would be great. Okay, so I'm going to guess there probably isn't anybody on from Compassion Communities Kingston, but they are really partnering up with their library actually, and that's a big space that they are connecting with to host these Atlas CareMap workshops. So that's one of the ways right off the top that they are going to use the tool. And I believe that they've partnered with some other organizations in the community who are focused on supporting, say, the aging, right? That seems like sort of a natural fit. Is there anybody on here from an organization? Like, do you have an idea on how you might want to share it and support the awareness and the spread of this resource and tool? If anybody feels comfortable sharing.
Hi, I'm Diane, and we have a hospice society I was explaining to Mary Lou with a goal to build a hospice. In the meantime, we are offering outreach programming, one of which is palliative navigating, but we also have a team of bedside respite volunteers. And so I can see this trickling through the navigators to the volunteers to use with the client.
Yeah, absolutely.
We also in our local library have a palliative corner, if you will. And so that resource could be available with the literature there.
Great. Yeah, I see a question on here about how does this fit in with some work. So I'm assuming, Peter, you're mentioning about the WEC model in the Windsor Essex area. So that, that's another sort of compassionate communities initiative, right? And so, really honestly, like I think the Atlas CareMap can go beyond even palliative care, right? Like we've had organizations reach out to us who are focused on supporting people who maybe have children with disabilities, right? And so absolutely, like an Atlas CareMap can work here, right? It's about the care piece, right? And so I think this has legs a bit more broadly than just end of life care, but of course, because that's PIME's mission, that was our focus in bringing this tool to Canada. Any other questions or any thoughts, feedback? I see a question about will we be sharing the slides? So yes, you will get a copy of the slides as well as the recording. So that will come to you and you'll have that. But you could always download the workshop toolkit and then you'll have it all. My plug, sorry. Okay, guys, well, I think that's it. I don't see any more questions. So really, thank you for joining us. Thank you to the Dorothy Ley Hospice for co-hosting with us. And yeah, please spread the word, create the awareness, increase the use of that tool, right? This is really why we've worked with Atlas of Caregiving to bring it to Canada. And there's been a lot of just really great research around the impact that this tool can have. So thank you, everybody, and have a great day.
Thank you.
Thank you,
Bonnie.
everyone. That was awesome. Bye.